My name's Stephanie, and I'm Dr. Rutledge's medical student this month. I'm also a patient of Dr. Rutledge's, and I'm just going to talk for a minute about nutritional deficiency with the Mini-Gastric Bypass. So we intentionally cause a nutritional deficiency in the Mini-Gastric Bypass because by doing that, we are able to lose a lot more weight. By bypassing the 6, 7, 8 feet, however many feet you had taken from your small intestine, and this helps with decreasing the amount of calories and the amount of intake and absorption of fats and other minerals that give us nutrients each day. But then, like I said before, it also decreases the amount of calories we have so we can lose weight. But because of this, it's essential that we get supplementation and extra protein and nutrients in order to maintain good health as well. So the body is not specific for what kind of tissue it breaks down when the body starts to break down the calories it needs for energy once the gut doesn't absorb as many calories and nutrients. So not only are you breaking down fat, but you're also breaking down heart muscle, leg muscle, and you need to keep that muscle mass up by intaking much more protein. And also Dr. Rutledge recommends taking in glutamine and creatine. So we cause a protein malabsorption. So Dr. Rutledge always recommends the whey protein, the glutamine and creatine supplementation, as well as weight-bearing exercise to maintain your heart function and your muscle mass. Also, we have a severe vitamin deficiency if you don't maintain taking your supplements and your vitamins. It's mostly common because of the duodenal and jejunal bypass that we've done in the small intestine. The duodenum absorbs the fat-soluble vitamins, which are A, D, E, and K. Vitamin A is important for the function of the eye, as well as many other maintenance functions throughout the body. Vitamin D is helps in calcium deposition. Vitamin E is an antioxidant, and it also helps fight infection. And vitamin K is an anticoagulant. So if you don't have these, obviously it is essential that it causes problems in the body. So you need to maintain your vitamin supplementation and also keeping up with that good diet that Dr. Rutledge always talks about. We also lose iron, B12, and folate much more frequently than other patients. And these cause anemia. Anemia can cause many problems in the body, such as fatigue and hair loss and shortness of breath, all sorts of things that will decrease your quality of life. So not only should you take your multivitamin, but if you do become anemic, you need to take iron supplementation and possibly a B-complex vitamin. A problem that's especially common in women is calcium deficiency, and that can cause osteoporosis and osteomalacia. This can cause brittle bones and a possible fracture in the future. So we also recommend that possibly in the future you may need calcium supplementation. Two other common vitamin deficiencies are also zinc and selenium deficiency. The zinc is commonly reflected by hair loss. You might see that from months 3 to 6 most commonly. So not only should you keep up that supplementation, but you should also eat that healthy diet that Dr. Rutledge always talks about. And he always says that he can help us become more normal, but we will never be normal patients. And so we always have to remember that we are healthier than we were before, but we will never be an essentially normal patient. Finally, a complication that you can see with the surgery is bacterial overgrowth. We have a decreased acid content in our stomach because of our surgery, and because there is not as much acid in the stomach as there was before, Bacteria, good bacteria or bad bacteria, can actually overgrow in the small intestine, and that causes malabsorption. This is not a common side effect of the surgery, especially in the Mini-Gastric Bypass versus the Roux-en-Y, but you should always watch for that. So the mainstays of prevention of anemia, osteoporosis, malnutrition, vitamin deficiency, and muscle breakdown would be healthy diet, protein, glutamine, creatine, and your vitamin supplementation.